we do have a lot of pregnant patients who are asking about whether or not they feel like it's safe, or we feel like it's safe for them to get the vaccine while pregnant. And what we tell them is, we do believe it's safe. We believe it's safe in all 3 trimesters. That's the current recommendation of American College of OB/GYN. There have not been studies specific with, pregnant patients, although ACOG, lobbied hard to have pregnant women involved in the early clinical trials, looking at the safety of the vaccines. But they have extrapolated a lot of safety data from some of the animal models that they've been looking at over in Europe, and that was part of the developmental and reproductive toxicities, the DART trials. And so, it's not fair to say that these vaccines have been brought to market without any, data. So, we do believe that they're very safe, and we're encouraging all of our patients to get them. The data does suggest that pregnant patients who test positive for COVID and who are symptomatic for the disease are at a higher risk for having more severe disease. And that includes intubations, admissions to the ICU, and even death. And so while the absolute risk for pregnant moms is pretty low, that means it's unlikely that anyone's going to contract COVID and have one of the severe outcomes. The risk is still there. So again, we do not see any contraindications for breastfeeding moms. We encourage that as well. That's the 2-shot vaccine series for both the Pfizer and the Moderna. The Pfizer separated by 3 weeks, the Moderna separated by 4 weeks, but anything that moms can do, especially while they're breastfeeding, to pass that antibody on to the babies. We know absolutely for years now that immunoglobulin is passed through the breast milk and can provide a protective benefit to that newborn. So that's just a wonderful way. We believe that it's the same risk-benefit analysis. I mean, we are encouraging our patients, this is an ideal time to get the vaccine, even if they're just contemplating pregnancy, or if they're under the care of an infertility specialist. I have encouraged my patients, though, to talk to their physician. Obviously not every physician agrees with what I'm saying, and so I think we have to approach this from a community perspective and a collegial perspective, and understand that because of cultural reservations, or just maybe a general distrust in the medical community. However, they should be able to get this vaccine with a pretty good amount of confidence that there should not be any unnecessary risk that we're not aware of already. If a mom suffers severe disease, that's going to increase her risk for having complications, and the baby certainly have complications. So that's another reason we're encouraging them to get vaccinations, and we've had a lot of success in my patients, maybe because I am encouraging it, and I think that goes a long way, but I do have patients who are reluctant as well. And so we have to support them as well, and encourage them to continue doing the hand washing, sanitizers, soap, social distancing, and mask wearing. Obviously, I'm not wearing my mask now because, I've had my full vaccination series, and I feel very confident that there's antibody there. And so at some point, hopefully, we're going to have a little bit more comfort in getting rid of these masks. But for right now, we're still encouraging everybody to wear them and socially distance and practice good hand hygiene.